is present with his counsel. The state's attorneys are present. The witnesses on the stand from the state.
Your Honor, this concerns the state's exhibit number 1. After consulting with Mr. Spencer, what we had introduced originally were 2 pages excerpted from Dr. Thompson's file. What we'd like to do is exchange those and mark a new exhibit 1, which would be the entire file containing those 2 pages.
Do you have any objection?
No, Your Honor, I think that's appropriate.
Very good. One is received, and it will replace state's exhibit number 1, which will be returned to the state's attorneys.
Thank you.
Anything further? Okay, could we have the jury in? Thank you. Please be seated. We are back on the record in the matter of State of Utah versus MacNeill. Mr. MacNeill is present with his counsel. The state's attorneys are present. The doctor is on the stand and the jury is again seated. Mr. Perkins, you may continue.
Thank you, Your Honor. Okay, Dr. Thompson. Before we move on where we were, I believe we were talking about the surgeries that you performed on Michelle. Before we move on from there, I just wanted to clarify some of your prior testimony regarding the extra drugs of Percocet and Valium. And specifically with Percocet, would you clarify who it was that requested that drug?
Martin.
When it comes to, let's fast forward now again back to the procedures that you performed, and how did the surgery go?
It's a long surgery to do that many procedures at once, and it went very smoothly. There were no problems with vital signs or anesthesia or bleeding. There were no complications during the surgery, and I would describe it as successful and uneventful.
Okay. You said it was a long surgery. Do you recall about how long it was?
It was scheduled for 8 hours. I don't know if that's how long it took or not, but it probably took close to that. And I remember calling Martin when I was done at the end of the day, and it was early evening when we spoke.
Earlier we talked about liver function and how certain drugs are cleared through the liver. Is the anesthesia that's administered one of those types of drugs?
Yes. Again, I don't know all of the specific drugs, which one is cleared by the liver and the kidney. Those are the 2 organs that clear most of these drugs. But yeah, there would be multiple drugs administered during the surgery that would be cleared by the liver.
If there were any complications with the liver that arose during the surgery, would there be symptoms that you would recognize?
Possibly, or
Sustained. I'm not certain who is the anesthesiologist.
Okay. Who was the anesthesiologist in this surgery? Let me ask you this, was it you?
No.
Okay. Have you observed patients post-operatively emerging from anesthesia before?
Yes.
And is there, based on your education, based on your experience, is there an expected time range in which they would emerge from the effects of anesthesia?
Yes, it varies from one individual to the next, but yes, there's a kind of a routine or a normal post-operative wake-up period, I guess.
Was Michelle's wake-up time during this procedure or after the procedures you performed, was that normal or not?
It was normal as far as to my knowledge.
Okay. If I could have 1 minute, Your Honor. May I approach the witness?
You may.
Dr. Thompson, I'm giving you a folder containing exhibits that are marked 2 through 13. Would you peruse those briefly?
Okay.
Do you recognize those photographs?
I think I've seen some of these before.
Okay. Where have you seen them before?
In this room or one similar to it.
Okay. When was that?
It was several months ago.
Okay. In relation to this case?
Yes.
Do you recognize the subject of those photographs?
It appears to be Michelle MacNeill.
And what's the context of them?
This appears to be some photos that were taken after she died.
Okay. Do you see incisions on her body?
I do.
Where are they?
They're pretty much exactly as I described for the surgery. All the incisions I see are incisions that were related to her surgery.
Okay. All of them?
Yes.
Are there any that are not? Excuse me. Are there any that you see that are not a result of the procedure?
No.
Okay. May I approach, Your Honor?
You may.
Your Honor, at this time, the state would move to admit, or the state offers exhibit number 10 into evidence.
No objection.
Is it multiple photographs?
It is just one photograph, Your Honor.
One? May I see it?
Yes.
Ten is received.
Thank you. And Your Honor, may I direct the witness?
Go ahead.
Exhibit number 10, will you describe the contents of that photograph?
This appears to be a photograph of a portion of the scalp on the right side with an incision just posterior to the hairline.
Okay, posterior to the hairline, will you clarify that?
That just means it's in the hair-bearing portion of the scalp, a couple of centimeters behind where it starts, where the forehead ends.
Okay, thank you. Is that incision, we've kind of covered this already, but that one specifically, is that part of the surgery?
It is, yes.
Thank you. Will you describe the normal post-operative routine for a patient who's undergone surgery like this?
For me, patients that undergo this type of surgery, I typically recommend that they stay overnight in the hospital for one night to be monitored for their breathing and their vital signs and pain medication and nausea, all the things that we've talked about that are typical for post-operatively. Usually the first 12 to 24 hours is when those symptoms are the most severe. and then they are discharged the following day. And then I see them several times during the first 10 days following surgery.
Okay. When it comes to the immediate time, or the time immediately after the surgeries, did Michelle follow the same routine?
She did.
Will you describe that with her case specifically?
So I don't know the exact timing of everything, but when we finish the surgery, the patient goes to a PACU area, which is where they're under very close supervision by a nurse, and they're usually still very sedated at this point and not interactive at all, because it takes usually an hour or two for the anesthetic effects to wear off. And then once the patient's awake and they can answer questions and they're behaving appropriately, then they would be transferred to the floor. And I typically will see the patient while they're in that PACU area, that immediately after surgery, while they're usually still asleep, and just check on everything for bleeding and vital signs usually. And
Is that, I think you've said that's where they come out of their sedation?
yes.
So about how long are patients normally in there?
Typically 1 to 2 hours, I would say, but it varies.
Do you recall Michelle's time?
I don't know.
Do you recall whether there was anything abnormal?
No, I don't think there was anything abnormal.
Okay. Were there any complications at this point?
No.
When it comes to, you mentioned keeping patients overnight and why you do that. Did Michelle stay overnight?
She did.
Did anyone request an early discharge for her?
If they did, I don't know about it.
Okay.
I see the patients very early in the morning, and so typically they're discharged about 9 or 10 a.m. the following morning.
Okay. If someone wanted to have her discharged, to whom would they have made that request?
The nursing staff.
Okay. And would the nursing staff contact you in that?
If I've already seen the patient and cleared them for discharge, then they wouldn't need to contact me, but if they hadn't, then they would.
Had you cleared Michelle for just discharge at this point?
At what point?
I'm sorry. Before the overnight stay?
No.
So the next morning, do you recall that date?
I can look. It would have been the 4th of April.
Okay. Did you visit Michelle that morning?
I did, yeah.
And what specifically were you assessing at that point?
The things that I would check for at that first visit are the vital signs, which have been recorded at multiple periods throughout the night. The drain outputs, I put little drains in to collect any blood or fluid that collects under the skin. The function of the facial nerve, which is in the area of where I'm operating during the surgery, to make sure that that's intact. And the vision, because I've been working around the eyes. And any hematoma, which means bleeding under the skin that's unusual or excessive.
Okay. Will you describe what Michelle would have looked like at this point?
At this point, she would be likely quite swollen in the face. I have a fairly tight bandage that's wrapped around the face for that first night, just to help prevent bleeding and fluid collection, and that was on, and I take that off in the morning. I remove the drains, and that's when I kind of assess all of these things. Okay. She would be talking to me and answering questions.
In the morning?
Yes.
Was anything on her eyes overnight?
Typically we'll put some little cold ice pads on the eyes to keep the swelling down.
Do you recall whether that was done with Michelle?
I'm sure it was, but I couldn't tell you 100%.
Did you record in your file any observations that you made on her specifically the next morning?
Just that I recorded all her vital signs. I recorded all the things that I talked about with the facial nerve, the bleeding, the incisions, the dressings, and everything was in order.
Okay. Do you recall whether anyone was present, any of Michelle's family were present that morning?
I don't recall if anyone was there or not. I'm quite sure Martin wasn't there because we would usually have a conversation that I think I would have remembered. There may have been one of her daughters there, but I don't really know.
Okay. Will you describe Michelle's discharge process?
So once I've assessed all of those things, then I give the nursing staff authorization to discharge her when the family comes and picks her up. And sometimes there'll be questions and things between that period, and they'll call me if there are. And the instructions for discharge and wound care have already been gone over at that point in the preoperative visit. And so the patient, I usually, if they have any questions about the wound care, we'll go over it at that time. And then if everything's good, we'll send them home.
Okay. And was that done with Michelle?
Yes.
Were there any complications that you noted before she was discharged?
No.
When was the next time that you visited with Michelle?
That was the 6th, 2 days later.
Okay. And is that normal?
Yes, that's when I check again all the incisions. I check for infection, for bleeding, and I have kind of a checklist that I go down and look at.
So do you have a kind of a set routine for visiting with patients after they've had surgeries like this?
Yes.
And I think will you go over it one more time?
Yes, so I see them the first day in the hospital before I discharge them. If they've had eyelid surgery, I'll usually see them at postoperative day 3, so that'd be 2 days after that visit, and usually remove the eyelid incisions at that, or the eyelid sutures at that time, and place tapes on the incisions. And then usually 2 to 3 days later, I'll see them again to take out some more stitches and assess everything. And then also, usually at 10 to 14 days, I'll do one final visit to remove sutures, and then usually I give them a few weeks before I see them again.
Okay. I moved forward before I wanted to. When it comes to Michelle's appearance at this point, we talked about her bandaging. What would her skin and incisions have looked like?
On that first day, or just swollen, maybe some bruising. And sometimes the patients can't even open their eyes at that point because there's a lot of swelling around the eyelids, and I would say that's fairly typical that they can't open their eyes.
Was that the case with Michelle?
Yes.
So when you mentioned that the next morning you changed bandages, and will you describe that?
So there's, like I said, there's a bandage wrapped around the face, and I'll usually talk to the patient for a few minutes first and ask them how their night was and check their drains, and then I just take a pair of heavy scissors and cut the bandages and peel them off and check the incisions and pull out the drains.
Did you do that with Michelle?
I did.
What type of bandages do you replace any type of bandaging?
Yes, I'll send them home with an ACE bandage at that point that just provides a little bit of light compression on the incision, but it's nothing like the original one.
Did you do that with Michelle?
Yes.
When Michelle was discharged, do you recall whether she was walking?
She was, I was not present when she was discharged. So most people get wheeled out in a wheelchair from the hospital because it's a long walk. And so that's the typical routine. But they would be up to the bathroom and things on their own before they're, cleared for discharge.
Did you see any of that with Michelle?
No, I didn't.
Was she in bed the whole time?
She was in bed when I saw her, yes.
So I don't know how you would refer to this. I don't know if it's the first post-op in the hospital and then discharge, and then the second post-op?
Usually the first one, the day after surgery, would be considered the first post-operative visit, and then the next one, when she comes into my office, would be the second one.
Okay, so let's talk about that second one. What date was that again?
That would have been April 6th.
Okay. Do you remember whether Michelle came on her own or whether she had company?
She would have come with someone. Every time she came, she was with someone.
Do you recall who was with her at this visit?
I don't.
Would you describe Michelle's recovery process at this point?
I would say it was fairly typical. She was fairly swollen. Most people are concerned with how they look at that point because their face is pretty swollen, and so we'll talk about some of those things and talk about the normal process of swelling and recovery from surgery. And we'll just kind of go through some of their questions and make sure their pain's under control and their symptoms are resolving.
Did Michelle have any complications?
No.
Did she have any unusual reports of pain?
Not that I recall.
Do you recall whether there were any problems with her medications at that point?
I don't think so. I don't have anything indicated in my notes, but I don't remember if we discussed the pain medications at all or any other medications.
If we could take a moment to discuss your notes, when do you make an annotation in your file on a patient?
Typically, the notes are made at that visit or shortly thereafter when the patient leaves the office.
Let me ask this, I would clarify. In addition to when do you decide to record something in your notes?
Well, if I always record the things that are kind of on my checklist, and then if there are other additional relevant pieces of information, then I'll include those, but I don't include everything that happens or that's said in the note.
Okay. If someone's progressing normally, would you note that necessarily?
Yeah, I would. I mean, I'll say that things are normal. It's more when things are abnormal that I'll make more notes.
Okay. Was anything abnormal about this visit?
No.
Was Michelle walking at this visit?
Yes, she was.
Did she need assistance?
I'm sure she had someone on her arm, just again because of the swelling, and usually with eyelid surgery, usually people just need a few days before they can see, their eyelids are not as swollen, they can see normally again.
Okay. Were you able to assess at this time, at this visit, what Michelle's vision was like?
What I will do on these visits, especially for this first one or the second one where I'm taking out the stitches, is if their eyes are swollen shut still, then I'll force them open and have them look from side to side and make sure that they can see me. If her eyes were open partially, then I wouldn't do that, and I don't remember whether or not I did that.
Okay. Let's go to day 5, I believe. Is that the third?
Yeah, it was the 10th, which was actually actually, you're right. I think I saw her. Yeah, I saw her on the 8th as well.
Okay. What's normally going on this?
That visit is where I removed the stitches and some of the front of the ear. To show I remove those.
Are you removing them because the incision is completely healed?
No, I'm removing because I don't want them to leave marks in the skin.
Okay, and how do you assist the healing of the incisions after?
So I just put some tapes called steri-strip on the incisions to reinforce, and typically there's enough strength in the incision if you tape it up at 4 or 5 days. That visit, I know that.
Okay. When you're visiting with a patient 7 days after surgery, what are you looking for?
At that point, I'm usually expecting a lot of the swelling to start going down a little bit, the bruising to start going down. I'm usually hoping that they're walking around a little bit and becoming a little bit more active. Nothing strenuous, but again, I'm primarily removing more stitches and then just doing kind of a basic assessment of me looking at them and talking to them.
Okay. Do you check up with your patients regarding the medications during these postoperative visits?
Typically, I will ask them about pain, and usually at this point, at this post-op day 7 visit, I'm usually not asking about other things except maybe sleep. It's usually if they bring things up to me, then I discuss them. But I typically am asking people if they're starting to wean off of their pain medications at this point, because this is usually when you start to not need them as much. And everybody's different again.
Sure. Did you ask that of Michelle?
I don't know for sure. I can't remember.
If you were to consult your file, would that help you remember?
Well, I do know that I gave more prescriptions at that visit, but those prescriptions were not requested at that visit. They were, a phone call for Martin was made to get those prescriptions refilled, and that's when they were refilled.
Okay. When it comes to whether you asked Michelle what she was taking at this point, if you saw your notes or if you consulted your file, would that help you remember?
There was a comment after me asking those questions, but not specifically to Michelle. This was after everything happened.
Okay. Were there any complications that you noticed at this visit?
No.
Was there anything unusual?
She had something called chemosis, which is swelling of the eyelids, and that's pretty typical. And I gave her some medications, and those are prescriptions for the swelling in the eyelids. And then, as I said, I did give more prescriptions for Percocet and Phenergan, but those were requested by a phone call after the visit.
She didn't ask for them at the visit?
Right.
How did that visit end?
I was happy with how everything was coming along, and I think she was starting to get excited about, she was starting to be able to see the result a little bit because some of the swelling and things were going down, and she was positive, and I was very happy with her progress.
When did you next hear from the MacNeills?
The next day.
What happened?
And that was, I'm sorry, it was 2 days later. I saw her on the 10th, and then I got a phone call on the 12th, an urgent call. Oh, I'm sorry. The phone call came on the 11th, and that was an urgent phone call from Martin stating that Michelle had been found unresponsive in the bathtub, and resuscitative efforts were begun, and she was at the emergency room at that point.
What was his demeanor like?
He seemed frantic and very upset.
Did he say why he was calling you?
No, but I assumed he would call me since she had had surgery recently.
Okay. What was your reaction?
I was very upset.
And why was that?
I just don't like to have complications with my patients, and anybody that's kind of still in that immediate post-operative period, I'm following them very closely, and it's just very upsetting.
So when you receive notice that a recent patient has had complications, what's your routine? What do you do?
Well, it just all depends. I've never had anything like this before or since. Usually they're smaller things, and I usually will have them come into my office, and if it's an infection or something, I'll have them come in, and check it out, but this was different.
What were your concerns in Michelle's case upon learning that she was unresponsive?
I was worried about what the possible cause of her unresponsive state could have been. I was worried about maybe she wasn't walking around enough and got a blood clot in her leg.
What could that do?
Then a blood clot in the leg can cause a pulmonary embolus, and that's one of the probably the more common causes of acute death after surgery. And that could happen anywhere, between the first day and a couple weeks after surgery.
When you considered Michelle's case, what did you think about the pulmonary embolus?
That was what I was kind of worried about because it was such an acute, sudden thing. And so that was the first thing that came to my mind, but I don't...
Was there anything else that you were concerned about in her case?
Well, I always worry about medications because, and particularly in this case, there had been a lot of medications prescribed. And so I asked some questions of Martin and her daughter. This was after that initial phone call, and asked them some questions about the medications that she was taking. And they indicated that she had been weaning off of those medications. She was down to 1 to 2 Percocet per day, which is what I would expect at that point in time.
Okay. When it comes to the blood clot, did that grow in concern, or did you rule that out? How did you?
I just waited to hear. I was, that was probably one of my biggest fears and worries. And I called one of my colleagues that had a lot. The person that trained me actually, and
Non-responsive.
Sustained. Can you proceed by question and answer?
Yes. I think we'll just proceed on.
Go ahead.
After that phone call that you received from Martin, did you have any other interactions with him?
Yeah, I spoke with him on the phone several times in the next week or so, and
do you know the outcome of Michelle's complications?
I really don't, and
Not necessarily the diagnosis, but did you find out whether she survived or died?
My understanding was that she had died on that original phone call that he gave to me, and they had done all of the resuscitative efforts that they could, but she had not been able to be resuscitated.
Okay. You said you interacted with him later. Do you know when that was?
I don't have the actual dates of when I called him, but I did call him probably 2 or 3 times over the next 4 or 5 days to check in and see, check on the family and check on him.
What was his demeanor on those?
He was very morose and just seemed very unhappy and depressed.
Okay. Did you attend Michelle's funeral?
I did.
Could I have a minute, Your Honor?
You may.
A couple subjects I'd like to revisit with you real quick. When it comes to, you mentioned that you reissued or refilled some prescriptions at the visit on the 10th.
Mm-hmm.
Will you restate whose request that was?
That was Martin.
And if I recall your testimony, that came over the phone.
Yes.
Did you discuss why you were refilling those? Was for?
So I guess what I should say is I did not speak with him directly. I had a message from my staff that they had spoken with him and he had requested refills on the medications.
Okay. Okay. your visit on the 10th with Michelle before she died, do you recall her demeanor?
As I said, I felt like she seemed pretty positive and upbeat and was excited, and she was smiling, and I was happy with her demeanor.
Was she able, how was she moving?
She was walking on her own, probably with a little assistance. I don't remember if she had someone on her arm, but she walked from her car into my office and back out.
Any problems with that?
No.
Okay. I think I'll tender the witness at this point, Your Honor.
Thank you. You may cross.
Good afternoon, Dr. Thompson.
Hi.
How are you today?
I'm nervous.
Understandable. Fair to say that sometimes when you're nervous, that affects your memory?
I don't know.
You've been interviewed about the circumstances in relation to Michelle MacNeill a number of times, right?
I have.
First one was on February 25th of 2009.
I don't have those records, but I'm sure you do.
Does that sound about right to you?
Yeah.
Okay. And at that interview, Doug Whitney and Jeff Robinson, investigators, came and
Yes.
talked with you
Yes.
at your office.
Yes.
And at that interview, one of the first things they told you is that they were investigating Mr. MacNeill for criminal activity and asked you if you'd seen the news.
I don't remember if they mentioned that. They told me that I wasn't the subject of their investigation.
When I ask you a question, you can just answer my question, and then if there's anything more that the county wants you to follow up with, then they can.
Okay, sorry.
Okay. And may I approach the witness, Your Honor?
You may.
Okay.
I need you on the record, I'm sorry. Whatever you've said, I need on the record.
Okay. I'm showing you a transcript of your interview, just asking you to review it and see if it refreshes your recollection.
Okay, so
So the question is do you now recall Mr. Whitney and Mr. Robinson informing you right off the bat that they were investigating Mr. MacNeill?
yes.
And asked you if you'd seen the news?
Yeah, I see it right there, so yes.
And the next time they came and interviewed was also at your office, right, on June 27th of 2011?
Sounds right.
And they asked a number of the same questions as they did the first time?
Yes.
And you gave honest and truthful answers on both of those occasions, right?
Yes.
And then the third time that you've been formally questioned about this was on October 3rd of 2012 at the preliminary hearing in this court. Is that right?
Yes.
And you gave honest and truthful answers at that time as well, right?
Yes.
When you first saw Martin and Michelle MacNeill in your office, they seemed happy together.
They
right?
did.
And in fact, you described them as happily going back and forth with each other as they were discussing the options.
Yes.
And in that first visit, Martin told you that he was a little concerned about hypertension and that he wanted to get it checked out before the preoperative visit, right?
No, not at the first visit. At the second visit is when hypertension. Or maybe he did. I really, it could be.
Let me just show you your preliminary hearing transcript.
Actually, I think that's right, because that's why he got it checked out subsequently. So yeah, I think that's correct.
Okay. And after they went back and forth with each other, they both mutually wanted to go forward.
Yes.
And you didn't get any indication that Martin was being overbearing and pushing the surgery, did you?
I didn't.
And in fact, you wouldn't have offered the surgery if you felt that way, would you?
That's correct.
You had no reservations about proceeding with the surgery?
I didn't.
And you had in this case, which I assume is typical, at least 3 different opportunities to discuss the surgery. The initial visit, right? Then the preoperative visit, right?
Correct.
And then right before surgery.
Right.
And on each of those 3 occasions, your patients have to express a desire to go forward for you to proceed with surgery.
That's correct.
So even on the day of surgery, if there is any hesitation in going forward, you wouldn't perform the surgery, right?
Well, if there's hesitation, we'll talk about it. But if there's, serious doubts or hesitation, then we wouldn't do the surgery.
And if a patient expressed a desire not to go forward at the preoperative visit, you wouldn't go forward with the surgery, would you?
Correct.
From your experience with Michelle, her blood pressure was always very stable, right?
Yes.
And although Martin was a little concerned about it, you didn't personally observe anything.
I never observed any high blood pressure.
And on the morning of surgery, her blood pressure was monitored multiple times to make sure it was safe, right?
Correct.
And there was nothing that caused you any concern about proceeding with surgery about her high blood pressure, correct?
Correct.
After one of your patients has a surgery such as this, you expect that they won't be driving for 1 to 2 weeks, correct?
That's correct.
And in this case, you saw Michelle on April 10th of 2007, correct?
Right.
And she was not in a condition that you would expect that she would be able to drive, correct?
I don't think so. I mean, I know she came with someone, but I kind of leave that judgment up to people.
And you've discussed whether you thought that she could drive with the investigators in this case, correct?
I'm sure, yes.
And fair to say that you told them that she absolutely would not have been able to drive based upon the nature of swelling that you saw on April 10th?
I may have said that. Like I said, some people, it goes down faster and they can drive. It just depends. But I don't remember.
On the visit on April 10th, you noted in your records that she had chemosis, correct?
Yes.
And that she was concerned about swelling, correct?
Right.
And also that she was still taking at least 1 to 2 Percocet a day, correct?
Yeah.
And fair to say that you would not recommend anybody to drive if they're taking even 1
Yes.
Percocet?
Yeah, I think that's true.
May I approach, Your Honor?
You may. Go ahead.
Dr. Thompson, I'm showing you a copy of the transcript from your interview on June 27th,
Okay.
2011, correct? You just review this.
Okay.
And you're free to look at the next page too.
No, so I just said that she shouldn't be driving at that point.
Fair to say that you said she definitely should not have been driving at that point.
Yes, it says it right there.
And in fact, I always insist that you've got to have rides until the swelling around the eyes goes down, right?
Correct.
You can't drive if you're on any pain medications,
Right.
correct? Michelle had swelling all around her eyes on April 10th, correct?
She had chemosis, yes, and swelling.
And she was still on pain medication.
Right.
She shouldn't have been driving.
Right.
You just testified about the Percocet medication being refilled on April 10th, correct?
Mm-hmm.
Your testimony today was that that medication was refilled pursuant to a phone call, correct?
That's my memory.
That's never been your memory before, though,
Okay.
has it?
All right. Well, why don't you remind me?
Well, have you ever said that in any interview that you've had before?
I don't know.
Is there anything in your notes to indicate that the Percocet was refilled pursuant to a phone call?
That was just my memory of it.
That's your memory as you sit here today, right?
Yes.
Yeah, you've talked about your memory before, correct?
I'm sure, yes.
Can you just impeach him with the inconsistent statement? It's not you're not refreshing his recollection, so just tell him what it is.
Yes. I just wanted to give him an opportunity to see it. On June 27th of 2011, the investigators suggested to you that they think Martin called in for that prescription. Do you recall that?
I don't, no.
Okay. Do you recall telling them that that couldn't have occurred because the prescription has to be done in writing for Percocet?
I don't recall that either, but that is true.
That's true.
Yeah.
Right? So the prescription would have had to have been delivered.
Or picked up by someone,
Picked
yes.
up by
Right.
someone, right? And in that interview in June of 2011, you never said that Martin called in to ask for that prescription to be
Okay.
refilled, did you?
Apparently not.
And in February of 2009, you didn't say that Martin called in to have that prescription refilled, did
Okay.
you? In fact, is that true?
It seems to be, yes.
And in fact, in both of those interviews, you said that you don't know who asked for that prescription to be
Right.
refilled,
Right.
correct?
Right. And I don't think I said definitively this time either. I said, I think this is what I remember.
Yeah. And so that's your memory today,
Right.
which is different from your memory in June of 2011 and February of 2009,
Okay.
as well as in October of 2012. You didn't say that Martin called in that prescription then either, did you?
Okay. I didn't, no.
You didn't, did you? You've continued to see media coverage about this case, haven't you?
I don't read any of it.
Don't hear anything about it?
I hear things, but I don't read anything, and I try to minimize my exposure as much as possible.
Continue to talk to the investigators about this case?
Just one phone call since the last time I was in this room.
In the preoperative visit on April 1st, you testified that Martin, Alexis, and Michelle were there, correct?
Right.
And in that visit, all three were enthusiastic about proceeding with the procedure, correct?
I'm not sure what Alexis's level of enthusiasm was, but maybe you have something.
At the preliminary hearing, you testified that Alexis was enthusiastically supportive of her mother.
Okay?
Is that correct?
Yes.
Is that consistent with your recollection now?
Yes.
Okay. Nobody told you at that April 1st visit that they wanted to postpone the surgery, did they?
No, I don't think so.
In both of your visits, both the initial appointment and the preoperative visit on April 1st, you considered Martin very protective of Michelle,
Yeah, I did, yeah.
very concerned about her.
I did.
And you don't recall Martin ever giving you a list of medications that he wanted you to prescribe, do you?
No.
It's very common for Phenergan and Percocet to be prescribed together, isn't it?
Yeah.
And it's also common for your patients after they've had surgery to go home with nothing obstructing their eyes, correct?
It just depends. Sometimes they go home with the iPad, sometimes they don't.
In this case, you've testified, as I understand it, that normal medications that you prescribe would be Lortab, normally in pills.
Correct.
Correct? And then you normally prescribe Ambien.
Correct.
Correct? And then you normally would prescribe the steroid, which is the Medrol dose pack.
Right.
Correct? And then an antibiotic, Keflex or Cephalexin.
Correct.
Right? And the erythromycin.
Eye ointment, yes.
Right. And then in all of your prior interviews, you've said that Phenergan is a normal prescription for you as well, correct?
I don't, if I said that was a normal prescription, I typically don't give that one to every single patient.
But you give it to a number of your patients?
Yeah, I do.
And so you had no concerns about prescribing Phenergan?
No, I didn't.
And the Phenergan prescription you gave was for suppositories, correct?
Correct.
You didn't give any prescription for oral Phenergan?
I don't know that for 100%.
Well, why don't you look at your records then to make sure? You've got your prescription pads in there.
Well, the
And they all...
The second Phenergan I gave, I didn't indicate whether it was a suppository or an oral, the one that I gave on the 10th, so I'm just not sure.
Okay. The one that, the prescription that is in there
Yeah.
is for suppositories, correct?
I think so. Let me just double check. Yes.
And most likely that you refilled the prescription in the same fashion originally?
Yeah, I mean, you could look at the record and find out. I don't really know for sure. Sometimes I call in the oral at that point. Sometimes I do the rectal. It just kind of depends.
Okay. In your records, Mr. Perkins has gone over a number of post-operative visits with you.
You may.
Just for your reference,
Okay.
I'm showing you a calendar.
For the record, this is a April 2007
Yes,
calendar.
April 2007 calendar. And in fact, may I mark it, Your Honor?
I think it would be helpful maybe to many people.
The calendar has been marked as Defendant's Exhibit A. Your Honor, we'd move for it to be received.
Any objection?
No objection.
A is received. Defendant's A is received.
In your records, you indicate that that you saw Michelle on April 8th of 2007.
Right.
And as I read the calendar, April 8th was Easter Sunday.
Mm-hmm.
You believe that you were in your office on Easter Sunday?
I know I was.
You were?
Mm-hmm.
And what time of day would you have?
It would have been in the morning, probably late morning.
Okay. I was just curious. That seemed odd to me.
I try to be consistent.
All right. In relation to the medications, you've indicated that you gave instructions about how the medication should be taken,
Mm-hmm.
correct?
Yes.
And the instructions that you gave were, quote, just to take them only as indicated, take one pill and assess the effect after a half hour or so, and if you need another of something else, then take it. But don't take all of them together, certainly, or anything like that.
Okay.
Is that a fair statement
Yeah.
of your instructions?
Mm-hmm.
And those are the instructions that you gave to Martin and Michelle when you gave the prescriptions on April 1st?
Most likely something similar to that.
And Phenergan, Valium, Percocet, and Ambien can be taken safely together, correct?
They can be taken safely, but probably not simultaneously.
And so when you gave the instructions about taking the medication, you told Martin and Michelle to follow the directions on the prescription,
Right.
correct? And so would you turn in your notes to the prescriptions
Sure.
that you gave on April 1st?
Okay.
And so in relation to Valium, you prescribed 5 milligrams of Valium, right?
Uh-huh.
And in the prescription note says 1-POQ6 PRN anxiety.
Right.
Fair to say that that's one pill by mouth every 6 hours as needed for anxiety?
Correct.
And then in relation to Phenergan, you prescribed 25 milligrams, correct?
Right.
And you put 1 PR. That stands for per rectal,
Correct.
right? Instead of like PO, which per oral, is that what the O
Right.
stands for?
Right.
Okay. So 1 PR every 6 hours as needed for, and use up nausea,
Nausea, vomiting. Yeah.
nausea, vomiting, okay. And then Percocet, you prescribed 1 to 2 PO every 4 hours, correct?
Okay, yeah.
Is that
Yes.
accurate? And then Ambien, you prescribed 10 milligrams, and then you put 1 PO, and yeah, I think I'll need your help on that.
QHS every
QHS.
evening as needed.
Okay, every evening as needed, okay. Thank you. And so the instructions on the medication indicated that these medications could be taken together with appropriate spacing. Fair to say?
Well, they don't say that they can be taken together. They just say they can be taken for that indication.
And your instructions is to take one pill, assess how you're doing after a half hour or so,
Right.
and then if you,
If you still have a symptom or a new symptom, then you can take another one.
Another one,
Yes.
right?
Correct. Or a different one, usually not the same one again.
Right, okay. And when you perform surgery and people are in the hospital, it's common to give these types of medications, correct?
It is.
And in fact, in the hospital, it's not uncommon to give them all together at the same time, is it?
No, you don't give them together. You space them out according to the symptoms.
Okay, isn't it fair to say that you've testified in the past that in the hospital, they're given together?
Well, if I said they were given simultaneously, I didn't mean that.
May I approach, Your Honor?
May.
Okay.
So at the preliminary hearing, you said, quote, "They could all be taken together at the same time as long as they were taking an appropriate dose."
That could mean a lot of different things, and what I mean by that is within the same window of time. You don't typically take a bunch of medications all at once. You assess, as you mentioned before, but simultaneously means that one is still on board when you take another one.
And so it hasn't cleared from the blood when you take another one.
Right.
Okay. And so then, at the preliminary hearing, I asked you, so please explain to me how would they be appropriately taken together at the same time safely? And you answered, well, as I said before, I would probably try to do just one at a time. That would be my recommendation. But if someone did take them all at the same time, I think they would be okay, because we give those combinations in the hospital post-operatively. That's what you said, isn't it?
Yeah, I mean, like I said, we typically don't give them all at once, but I think you asked me, could you give them all together? And you probably could, but that's not what we typically do.
Well, my question was, would you like to review it again?
Just tell me, I can.
So my
I
question
think
was,
I'm sorry, I think, is it the same one you've just done, the same statement you've just done?
there's another part of it.
Okay, go ahead.
So my question was, and so please explain to me how would they be appropriately taken together at the same time? And then we just went through the first part of your answer, and the last part of your answer is, quote, "We give a lot of medications simultaneously, and you know, that's indicated and people are okay. But when people are at home, I have a higher level of caution, and I always tell people, you know, if certain medications have effects that can combine, then I generally tell them to take one at a time."
Okay.
Is that an accurate statement?
Yeah, but like I said, whatever I said, they're not typically administered at exactly the same time. You give one medication and then assess, and that's whether it's in the hospital or not.
Sure. Your opinion was that if there's, even if one of the Percocet, the Valium, and the Ambien, and the Phenergan, even if they were taken together, one pill of each.
Right.
You didn't think that
I thought that would be okay.
Yeah, you didn't think that would.
I don't think that would result in someone's, becoming hypoxic or stopping to breathe. But
And that's based upon your experience.
yes, and every patient's different again, you know.
Of course.
If it's someone that's doesn't have a lot of body weight, then that may be different.
Michelle was 180 pounds.
She was kind of an average adult, yeah.
In fact, in Michelle's case, the medications that you ordered for her to be administered in the hospital included morphine, Vicodin, which is Lortab,
Right.
hydrocodone,
Right,
Tylenol,
right,
Ambien, and Zofran.
right,
Zofran's a different type of anti-nausea.
correct.
And so you expected that the medications that you ordered in the hospital could safely be administered to Michelle in the hospital.
Right, under a nurse's supervision.
Of course. You didn't expect that they would cause death, did you?
Correct.
And those are similar medications to the medications that you prescribed to Michelle.
They are.
And even the normal medications that you prescribe, the hydrocodone and Ambien and Phenergan sometimes, they're dangerous medications, right?
They can be.
They can be, and if not taken appropriately, they can have bad consequences.
Definitely.
When medications are taken pursuant to your instructions to take one and then wait and determine a half hour or so and determine if symptoms persist and you need to take another one, the medications don't immediately clear from the system whether your liver is working well or not.
Correct.
Pretty common for medications to remain in your system 1 to even a few days, right?
Yeah, it just depends, but yeah, they take several hours to clear.
And so if somebody is taking these medications appropriately, following your instructions, and at any given time their blood is drawn, it wouldn't be surprising to you to find levels of each medication in that blood. Fair statement?
Right, except that I don't know the clearing times of all the medications, and I think they are different from one to the next.
Yeah. If somebody's taking them all during a period of time, though, it wouldn't surprise you to find all of the medications in.
Objection, asked and answered in foundation.
Overruled as to foundation, sustained, asked and answered.
In relation to the Lortab that was prescribed in liquid form, the liquid form has the exact same medicinal components as the pill form.
Yes.
Correct? And when Martin asked to have the liquid form of Lortab, the discussion that you and he had was so that there would be an option to have both a pill form or a liquid form of pain medication.
Right.
Right? So that if Michelle was struggling to swallow, there would be an option.
Right.
And the Phenergan was requested in a suppository for similar reasons.
Right.
To help with nausea through an administration route that wouldn't require necessarily to go through the mouth.
Yeah, it probably wasn't requested as a suppository, but that's what I prescribed.
That's what you prescribed.
Right.
Okay. Regarding the metabolization of medications in the liver, you don't know whether or not there were any liver complications after the surgery, do you?
What do you mean by that?
You don't know whether there was any developing liver problems after the surgery.
No.
That's all the questions I have.
Thank you, Mr. Spencer. Does the state have redirect?
Yes, please, Your Honor.
Go ahead.
First, I'd like to ask you about your interactions with law enforcement in this case.
Okay.
Have you met with investigators about Michelle's death?
I have, yeah.
And have you met with prosecutors?
Yes.
What was your understanding of the purpose of those meetings?
To gather information.
Has anyone instructed you on what to say?
No.
Has anyone tried to influence you about what you should say regarding Michelle?
No.
What did you do, if anything, to refresh your memory for testimony today?
I didn't do anything. I just, actually I did look through the chart last night, and but that was it.
Okay. What did Martin tell you Michelle was taking when it came to medication before her death?
According to my records, it was 1 to 2 Percocet per day.
Mr. Spencer asked you some questions about theoretical possibilities of when medications could be taken.
Right.
I'd like to discuss with you what was actually happening with Michelle. To your knowledge, was she taking all those medications?
Objection, Your Honor, foundation.
Sustained as to at a point in time.
Did she report to you during their post-operative visits about her consumption of medication?
That I just don't remember, and if I've given previous statement, that would probably be better than what I have right now.
Okay.
You may.
Let me ask you this. When you visited with her in those post-operative visits, did she report to you any of the symptoms that would require these drugs?
I don't recall her reporting any of those symptoms.
What was your understanding of her use of those medications?
That it was becoming less and less.
And that's based on
my notes and the visit that we had.
what was the indicated use of Ambien?
For sleep.
And what were your instructions about taking that medication?
To take it in the evening.
There any medical reason for her to take it in the morning?
No.
Okay. I'd like to talk about overlapping effects a little bit more. If I have pain and anxiety, and I take a medication for one or the other, let's say I take it for pain, what happens to my anxiety?
It very likely will be reduced with the pain medication.
So if I were assessing half hour, hour later, what would you say about my need for the anti-anxiety?
It could be.
Your Honor, foundation and an incomplete hypothetical.
I'll withdraw, Your Honor.
Sustained, I think it's speculative. Go ahead.
Okay. When it comes to driving, to your knowledge, have patients driven within the 1 to 2 weeks after surgery despite your recommendation?
Yes.
Do you know whether Michelle was driving or not?
I don't.
If a patient of yours were taking all 4 of those medications that we've been discussing, how would you expect them to present?
Objection, Your Honor, foundation.
Well, how's foundation lacking?
Because we don't know how much they're taking, when.
I'll
Sustained.
refine the question if I could.
Sustained. Go ahead.
The medications that you prescribed and the dosages that you prescribed, if Michelle had taken all of those, what would you expect to see in her?
Same objection.
Sustained.
Okay. How did Michelle present to you at her postoperative visits?
She was awake, alert, and behaving appropriately.
Was it consistent with profound central nervous system depression?
No.
Okay, that's all I have.
Thank you. Do you have any additional questioning?
No, Your Honor.
Dr. Thompson, thank you. You may step down. May Dr. Thompson be released from his subpoena? Thank you. Periodically during the next 5 weeks, you will find I forget that. And so if you would raise your hand if you have questions, that will help remind me, or someone can just say, Judge, what about questions? And that will help me remember. Do you have any questions for Dr. Thompson? If you'll raise your hand. Okay, if you'll write it down on a piece of paper, please, and the bailiff will collect it. Counsel, would you approach the bench? I have two questions for you from the jury, Dr. Thompson. The first is, did it concern you that Martin was acting as the primary care physician for Michelle?
Yeah, I thought that was a little bit unusual.
And secondly, did you raise any objections or concerns with Martin and Michelle about that?
No, and also he'd consulted with another physician, so that kind of made me feel a little bit better.
Okay. Do you have follow-up questions from the state?
No, Your Honor.
From the defense?
No.
Very good. You may step down. Thank you. May Dr. Thompson be released from his trial subpoena.
Your Honor, we may want to call him for rebuttal, but we don't anticipate doing so right now.
Okay. You'll remain under your subpoena, but you'll be contacted if you're needed again. Thank you. You may call your next witness.
State calls Vaughn Welch.
I'll see if it works. Are you Dr. Welch? Where's Dr. Welch? Thank you. If you'll come right up here to the clerk's desk. Face the clerk here. Please raise your right hand, sir, and take an oath.
You do solemnly swear the testimony you shall give in the case now pending before the court will be the truth, the whole truth, and nothing but the truth, so help you God.
Thank you. Would you be seated here, please, and respond to counsel's questions?
Good afternoon. Whoa. Would you please state and spell your name for the record?
Vaughn, V-O-N, Welch, W-E-L-C-H.
And how are you employed?
I'm a physician at an Intermountain Clinic
Where at?
in American Fork, Utah.
And how were you employed in March of 2007?
As an internal medicine physician.
Okay. What kind of training and education do you have to make you a doctor of internal medicine?
I completed medical school at the University of Utah, and I completed a residency in internal medicine at UCLA in California.
Are you a licensed physician in the state of Utah?
Yes.
And for how long have you been a licensed physician?
It's been about 21 years.
Are you licensed in any other states?
No.
Have you been?
I was licensed in California.
Have you ever been sanctioned or disciplined by the Department of Professional Licensing or any similar agency?
No.
Based on your experience and your training, do you have the ability to assess general health and wellness?
Yes.
On March 29th of 2007, did you perform an examination of Michelle MacNeill?
Yes, I did.
And why did you perform that exam?
I had been requested by her husband to perform a preoperative exam.
And who is her husband? Or who was her husband?
Martin MacNeill.
Is that person in court today?
Yes.
Could
He's
you
right
point him
over
out
here.
for us? Could you point out who he
Yes.
is?
It's the gentleman right here on the front table.
Do you stipulate to identification? Do you stipulate to identification?
We do, Your Honor, yes.
Thank you.
And so he called you to perform an examination of Michelle.
That's correct.
Did he tell you why he needed Michelle to be examined?
She was preparing for surgery and needed a preoperative clearance before that surgery.
Okay, and so because he called you, did the two of you have any kind of relationship prior to him calling you?
Yes, we worked together. He was the director of the developmental center in American Fork, and patients from there would be admitted to American Fork Hospital, and I would take care of those patients while they were in the hospital. He would take care of them while they were in the center.
So you were associated through your professional capacities. What were your impressions of him as a professional?
Objection, Your Honor, relevance?
Counsel, will you approach? Do you withdraw the question? Thank you.
In working with the defendant in a professional capacity, did he impress you in any way as a physician?
There were things that I liked and things that I didn't like.
Let's focus on the things you liked.
I liked his focus on reducing medications when they weren't necessary. Many of the clients in that facility before he was the director were, in my opinion, over-medicated, and he was willing to back off on the medicine so they'd be a little more awake.
This exam you performed on Michelle MacNeill on March 29th of 2007. What kind of an exam was this?
It was, again, she was a new patient to me, and my focus was on understanding her medical history and giving a report or finding out if it was safe for her to proceed with surgery.
I recognize this examination took place a while ago. Do you remember it?
Yes.
Did you make notes of any kind or have records or anything that could help refresh your recollection of that?
There are records in her medical chart.
And have you reviewed those?
Yeah. Not recently, but I think the court has those.
Okay. Did you perform any kind of labs or other medical metrics when you met with her?
Yes, we performed an EKG, electrocardiogram, and we performed blood tests.
Okay. What can you tell us about this examination?
Both the patient and the defendant were there at the beginning of the examination. We reviewed her medical history, reviewed her symptoms, review of systems. We talked briefly about the surgery that she was preparing for. We talked about I performed an examination of her body systems. We talked about the fact that she had high blood pressure and that it would be ideal to have that controlled before she went under surgery.
How did you determine there was high blood pressure?
Well, we took a reading in the office and it read high, and the patient or her husband at that time reported some previous readings that were also high.
Okay. I'm going to ask you to do me a favor. Would you mind pulling that mic a little bit closer to you? Thank you. And so this was a physical to assess Michelle's general health in preparation for a surgery.
That's correct.
What was your understanding about the type of surgery that this was?
The only thing that I knew was that it was cosmetic surgery.
What was your assessment of her health?
She was in excellent health with two exceptions. She had elevated blood pressure and she had depression.
Okay. Now you mentioned that at the appointment it was yourself, the defendant, and Michelle. Did it continue to be the three of you throughout the entire examination?
During the course of the examination, I asked the defendant to leave the examining room because he was answering all of the questions for her. I felt like she could speak more freely if he was out of the room.
And did that in fact happen?
Yes.
Did you talk to her then to assess her health?
Yes.
And what did she tell you?
She just said that she was very depressed and stressed and had a lot of symptoms that were related to that stress, but she did not provide details.
Did you offer any treatment options?
I did.
What were those?
I recommended that she start on sertraline, which is an antidepressant.
Is there another name for this drug?
Zoloft.
Okay. Any other recommended treatment options?
I recommended that she start treatment for the high blood pressure with a medicine, lisinopril hydrochlorothiazide.
Anything else?
I recommended that she put off surgery until the blood pressure was controlled, and that she report her blood pressures a week after starting treatment.
Now, you mentioned that...
I'm sorry, and that she do what?
I wanted her to report her blood pressure results a week after starting the medicine.
Thank you.
And why would you want a second report of the blood pressure?
I wanted to make sure that the medicine was effective but not too strong.
And when it comes to diagnosing high blood pressure, what kind of a process is that?
To make the diagnosis, you need a couple of readings at different times in a relaxed environment with the patient at rest.
Okay. You mentioned that you performed an EKG.
That's correct.
And why did you do that?
She gave a history of heart palpitations in the past, and just as a precaution to see the health of her heart.
And you performed that yourself?
Yes.
And did you interpret that test yourself?
Yes.
And how did you feel about that test?
The test showed that her heart was in the normal sinus rhythm without any irregularities, and that there was no evidence of heart disease.
Was the high blood pressure the type of thing that would make it so that the surgery would have to be postponed?
Depends on how high the blood pressure is and the point of view of the anesthesiologist and the surgeon.
In Michelle's case, what did you think?
I think that her blood pressure was in the neighborhood of 160 over 110, and I think there's a chance they would have canceled it.
Were you worried about long-term risk?
Yes.
Did the EKG cause you any concerns?
No, it was reassuring that it was normal.
Can you tell us about how Michelle was when you were trying to get her to talk about her health and wellness?
She was quiet. She didn't have very much to say. She would answer a question and then be quiet. It was very difficult to get much history or information from her.
Had you been told whether or not the surgery had been scheduled yet?
My recollection is that there was an urgency or an impending surgery and that this needed to be done quickly, but I wasn't aware if a date had been set.
And so you said you offered a recommendation as it came to the surgery, is that correct?
Right. I recommended that she put it off until the blood pressure was controlled.
And who specifically did you tell that recommendation to?
I told it to both the patient and the defendant.
What was the defendant's attitude about postponing the surgery?
He seemed disappointed, but seemed to agree with it.
What was the defendant like during this examination?
Defendant,
Your Honor, vague and speculative?
You're referring to demeanor,
Yes.
if you'll rephrase.
What was the defendant's demeanor like during this examination?
the defendant was anxious that we complete the evaluation and that she could proceed with surgery without having a delay. He was a little bit animated, a little bit excited, to try and get things going. And then at the point where I suggested they wait, then there was a little bit of disappointment.
Did this feel abnormal to you?
A little bit, yeah.
Did you later hear of Michelle MacNeill dying?
Yes.
What were your thoughts about hearing of her death?
I was called by the emergency room physician the day that she passed away, and I was shocked
Why were you shocked?
because at the time that I had examined her, she was healthy, and it was just unexpected to hear that she'd have a bad outcome from surgery.
Were you surprised that the surgery went forward?
Yes.
Thank you, Dr. Welch.
Do you have cross? Yes. Go ahead.
Dr. Welch, fair to say that Martin was frequently animated in your associations with him?
Yes.
And you have provided testimony before at the preliminary hearing in this case, right?
That's correct.
And prior to that, you had an interview with investigators Whitney and Robinson,
Correct.
right? And that was on June 15th of 2010,
Probably.
all right? And then the preliminary hearing was last October of 2012,
Sounds reasonable.
all right? Okay. And you gave your best recollections of what occurred in both of those prior opportunities to testify about this circumstance as well. Fair statement? Okay. And in the interview that you had in 2010, in June of 2010, obviously that was closer in time to the examination that you had with Michelle, right?
That's yet, was that yes?
Yes.
Yeah, thank you. Go ahead.
And closer in time from today.
Yes.
And when you met with the investigators, you told them that you believed that you had seen Michelle twice. Do you remember that?
I don't remember that particular conversation.
Your Honor, may I approach?
You may refresh his recollection.
Or did it say twice?
Can your co-counsel help, and we'll move on?
We've got one spot and there's one other one.
Would you like me to respond?
Yeah. Does that refresh your recollection at all about what you said with the interview with Mr. Whitney and Mr.
Yes,
Robinson?
it refreshes my recollection.
Okay. And did you indicate to them that you thought that you had seen Michelle twice?
There was a question as to whether I had seen her once or twice, and I was not able to resolve that during our conversation.
And when you looked at your records, you only had records for one meeting.
Right.
Is that correct?
But I think I know why I had the recollection of a possible second event, and that's that when our labs and information come back, then we, rethink about the patient. And in her case, her labs came back after her visit, and so I sent her a message after the visit, giving her instructions and information.
And when you were talking with investigators Whitney and investigator Robinson, you told them that the reason you had a recollection of meeting with her twice is because she may have called back and said, "This is what my blood pressure is surgery okay?"
I don't know what I was thinking then. I just know that I think that the possibility of that recollection came from the responding to the lab results.
Fair to say that you advise all of your blood pressure patients to monitor their own blood pressure?
Yeah, if they're adults and they're able to do it.
And that's what you told investigators Whitney and Robinson, that you recommend, or I advise all my blood pressure patients to have their own monitor and to measure it.
That's correct.
Is that correct? And fair to say that you told investigators Whitney and Robinson that yeah, I think she had a date for surgery and everything. I think we just wanted to look at the blood pressure issue since she's going forward with it.
I think that's an accurate transcript.
That sounds right to you?
Yeah.
Okay. And then fair to say also that you said, I think that she would have called, and when we talked on the phone, she said, her blood pressure was this, and I would say, okay, go ahead with the surgery, but I don't have any record of that?
Right. I was explaining that my usual approach is that someone would call back and report their blood pressure, and then I would adjust their medications or whatever.
So in the case of Michelle, based upon your recollection in 2010, you believe that she had called in, reported her blood pressure?
No, she didn't ever call in and report her blood pressure. But our usual protocol was for someone to make a change on their medications and then give a report, and then we would make an adjustment if needed.
Okay. In 2010, you told the investigators that you think that she would have called. And we talked on the phone, and she said, this is the blood pressure, and you would say, okay, go ahead with the surgery. Isn't that what you said in 2010?
What I said in 2010 is written on the transcript.
Would you like to see it?
But
No
just
trick
to impeach him with it. You don't have to show it to him.
Okay.
I'm not sure what you're trying to ask. You're wondering how much I remember of the second conversation?
All I want is to confirm, in 2010, you told the investigators that you believed that Michelle had called in and said, this is my blood pressure, and you would have said, okay, if it's good, go ahead with the surgery.
In 2010, I thought she might have.
Okay. And you don't have any record?
I don't have any record or
Of it either way.
specific recollection of it. I'm just, again, as I explained to them, my usual protocol is to follow that procedure.
And you had a recollection also in 2010 of thinking that you had met with her twice, but you only have records of one meeting, right?
I think my recollection at that time was of having met her once and maybe talked to her on the phone once.
When you asked to speak with Mrs. MacNeill alone during the examination, Mr. MacNeill didn't throw a fit or have any problems with it, did he?
No.
When Investigator Robinson and Whitney met with you, they told you that they were looking at filing charges against Mr. MacNeill, didn't they?
Objection, hearsay.
Is this for effect on the here?
Yes.
Overruled.
What's the question again?
When Investigator Robinson and Whitney met with you, they told you that they were going to file charges against Mr. MacNeill,
I
didn't they?
believe so.
And they told you that they were having a real hard time. We're having a heck of a time getting past Dr. Gray, didn't they?
I don't remember that statement.
For what purpose? May.
What is your question?
When you met with Investigators Whitney and Robinson, they told you that they're having a heck of a time getting this past Dr. Gray, didn't they?
Apparently, I don't recollect that aspect of the conversation, but I trust the transcript.
Your Honor, I'm going to move to strike because he didn't ask him if it refreshed his recollection.
Sustained.
In your experience as a physician, it's common for Percocet and Phenergan to be prescribed together. Fair statement?
I've seen them prescribed together at times.
At the preliminary hearing, you indicated that Percocet and Phenergan are prescribed together frequently. Is that correct?
Yes.
And based upon your examination of Michelle MacNeill, you didn't see any contraindications to prescribing those medications, did you?
I don't remember that.
Well, I'm asking you if that's just a fair statement. Based upon your examination of Michelle MacNeill on March 29 of 2007, did you see any contraindications to prescribing Percocet and Phenergan together?
Well, her examination was normal, so she would be treated as anyone else that is normal.
Right?
And those are prescriptions that are used for people that have normal health.
And that's my point. So you didn't see any reason that it would be unwise to prescribe Percocet and Phenergan together based upon your examination of Michelle, correct?
During our examination, there was no question of what medications would be used or what medications would be safe.
I understand that. My question is simply that there was no reason that you saw that would indicate to you that it would have been improper to prescribe Percocet and Phenergan together to Michelle MacNeill in April of 2007.
Again, her health was good. There was no contraindication to using those medications.
You also didn't see any contraindications to the medications of Ambien and Valium either, did you?
Again, at the time of the examination, that question was never brought forth or considered.
I understand. I'm just asking you as a physician. You didn't see any contraindications to her being prescribed Ambien and Valium based upon your knowledge, correct?
I object is outside of the scope, Your Honor.
Overruled, he may answer.
My opinion is these kind of medications carry risk and carry danger, and they should be used carefully. And that there was nothing in my examination of Mrs. MacNeill that would contraindicate the normal use of those medications.
In addition to, well, do you remember in your meeting with investigators Whitney and Robinson, them talking to you about many allegations that Mr. MacNeill's daughters were making against him?
Yes.
Does that refresh your recollection at all on their discussion with you about Dr. Gray or the Utah State Medical Examiner?
I don't know Dr. Gray.
Do you recall them discussing with you having a difficult time with the Utah State Medical Examiner in relation to their
I
investigation?
remember something about the medical examiner.
Just asking a yes or no. Do you remember them discussing with you having a problem with the Utah State Medical
No.
Examiner? You still remember that? Okay. That's all the questions I have.
Thank you. Do you have redirect for the doctor? Go ahead.
Is it fun to testify here today, Dr. Welch?
No, it's not.
Sounds like the investigators shared some facts with you about their investigation. Did that in any way influence what you remember about your meeting with Michelle MacNeill on March 29th of 2007?
No.
Are you telling the truth today?
Yes.
Thank you.
Do you have questions for Dr. Welch? If you'll write it down and pass them to the end of the row, the bailiff will collect them. Looks like we have some others. Any more? Did I no? Okay. You may. Dr. Welch, what kind of facility was it that Dr. MacNeill worked at, and what were the patients there for?
He worked at the Utah State Developmental Center, which is a facility that takes care of individuals with severe mental handicaps.
Thank you. Do you have follow-up questions
State does not.
from the defense?
In your testimony earlier, you indicated that Mr. MacNeill, you admired Dr. MacNeill because of his stance in decreasing the medications of the patients at the developmental center, correct?
That's correct.
And that was based upon a comparison between his practices and the practice of the prior medical director,
That's correct.
correct? So it was the prior medical director, not Dr. MacNeill, that you thought perhaps had the developmental center patients on too much medication.
Correct.
Okay, thank you.
Anything else?
Just real briefly,
Okay.
and Could I stand here for the question?
Yeah, that's
Your Honor?
fine. Go ahead.
Was it your opinion that he merely reduced it or that he appropriately balanced it?
It's a very difficult job to balance seizure medications in people that have severe brain injuries. And some physicians take an aggressive approach at eliminating all seizures. Some take an approach of reducing medication. And Mark MacNeill was more towards reducing the medication so the patients were more awake.
Thank you.
May Dr. Welch be released from his trial subpoena?
I wonder if we could treat him the same way as Dr. Thompson unless we contact him. He's
Very good. Dr. Welch, you'll remain under subpoena. If you are needed, you'll be called to come back, but you may step down today.
All right, thank you.
Thank you very much. Should we recess for today then, counsel? Okay. Ladies and gentlemen, thank you for your patience. I've indicated that we would try to conclude at 3 o'clock, and we're close today. We'll now recess for the evening. Please keep in mind my prior instruction to you. Don't form or express an opinion about the case either amongst yourselves or to anyone else. It's your duty not to discuss any subject of the trial among yourselves or with anyone else, including family members and friends that you'll see during the course of the evening. Avoid television, radio, or internet news coverage of the trial, and don't do any research on your own using your computer, electronic devices of some kind, or books, anything else. Have a pleasant evening. We'll reconvene at 8:30 in the morning. Thank you. Please be seated. We are now outside the presence of the jury. Are there any matters that we need to deal with housekeeping before we recess?
I think we just wanted to go take a look at the bathtub, Your Honor. It's on the 4th floor.
Okay.
Is it suffice?
Do we need to make that a matter? Do you need me there, or I would like to see it and see what we're looking at size-wise. And
I don't know that we need it on the record.
okay. Why don't we meet together with counsel? Is it on the 4th floor? Okay. In the other, could you approach? Council, thank you for your work today. We will reconvene, not on the record, but just to examine the demonstrative exhibit upstairs. I'd like Mr. MacNeill to go up with us. Again, I very much appreciate your careful preparation today and your work. Court's in recess.